Take action against COVID-19. How to protect yourself and keep everyone around you safe too. COVID-19 is a disease caused by a novel coronavirus that originated in Wuhan, China, and has since escalated into a global pandemic. In addition to community measures put in place by the President of the Republic of Uganda and the Ministry of Health, this video provides guidance on what to do in your drug shop, pharmacy or clinic to take an active role in our effort to defeat the virus. It is critically important that you follow this guidance in preparing your facility, your management of patients and referral of suspect COVID-19 cases. We all have a collective responsibility to protect ourselves, the patients and the community. The first confirmed case of COVID-19 in Uganda was reported on March 21, 2020, and cases have started to rise. And if we don't take strong preventative measures, we could see more of these cases. It takes between 1 to 14 days for the virus to incubate. Infected people can transmit the virus even before showing symptoms. Some infected individuals never show symptoms at all. Symptoms of COVID-19 include a fever, cough, fatigue, headache, and in severe cases, difficulty breathing. However, similar diseases like common colds, flu, malaria, and TB could present with similar symptoms, so health workers should remain vigilant, guide their clients, and refer them for proper diagnosis. The virus is transmitted through airborne droplets from a cough or sneeze from an infected person. It can also be contracted from touching surfaces, and the virus can stay on surfaces for several days. It has also been confirmed that the virus can be transmitted through aerosols from the breathing of infected persons. Before you or your employees go to work, do a daily health check to see if you have any symptoms and check your temperature. If you do have symptoms, stay at home. At work, be sure that they are easy to access hand washing facilities with soap and water. Alcohol-based hand rub can be used if soap and water are not available. Wet your hands with clean running water, warm or cold, turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the back of your hands, between your fingers and under your nails. Scrub your hands for at least 20 seconds or what it takes to say happy birthday, happy birthday. Observe the 5 moments of hand hygiene. First, before you touch the patient. Second, before you conduct a sterile procedure. After you come in contact with bodily fluids. After you touch the patient, and after touching things in the patient's environment. Uganda, like other countries, is experiencing a shortage of personal protective equipment. Make sure that you use the correct protective equipment as guided by the Ministry of Health and the World Health Organization. Staff are also encouraged to observe social distancing recommendations. Conduct a health screening of all patients coming into the facility. Look out for symptoms such as a temperature of about 37.5 degrees Celsius, cough, shortness of breath, fatigue, muscle pain, congestion, or sore throat. While conducting health screenings, provide suspected COVID patients with a mask immediately. Health facilities are encouraged to set up an isolated or separated waiting area for suspected COVID-19 cases. That is a minimum of 2 meters from non-suspected cases. This could be a separate room or a barrier between patients in the relevant. Be sure to wash your hands and encourage the patient to wash theirs as well. If your patient has the symptoms of COVID-19 that include breathing difficulties, fever and cough, please call the Ministry of Health hotline on 919 or the District Health Office for step-by-step instructions on what to do next. In this video, you learned the symptoms of COVID-19, how to protect yourself and your patients, how to evaluate a patient for COVID-19, and what to do if you suspect a patient has COVID-19. This message is brought to you by the Ministry of Health, in partnership with the Uganda Healthcare Federation and with funding from Think Well.